So these are examples of questions. You see that shock is being manifested, and then, but they don't tell you, like I said, you have to figure out whether it's shock or not. So for this question, we have a client was admitted with presumed diagnosis of what? Acute pancreatitis. Which of the following need immediate priority action? So this is the patient admitted with acute pancreatitis. Which of this is a priority action? So this is a prioritization question because of immediate, and there's a priority action. You have to think about it. We have our acts, our case, our pathways, and we rewrote it, and we figure out what is the problem. All he's saying is somebody has acute pancreatitis. Which one should you worry about? That's all. And you know what is a pancreatitis? You have to basically bring in your content, and he said, okay, I'm taking my content and analyzing each answer choice and see whether there's any priority action. And you'll be thinking at the back of your head whether there's a B-sharp moment over there. Amylase of 1,000, this is an expected finding for pancreatitis. This is from the pancreas being injured. They release amylase and lipase. So this is not a problem. Paralytic ileus, basically when there's inflammation of the pancreas, the GI tract will slow down and you develop ileus, like obstruction, but it's not a true obstruction. Basically, transit time has changed. So this is not a problem. Calcium of 7.9, this is low, but we're dealing with priority action. We'll see if there's anything there. This is low, so it can be a priority. The reason why it's low is in pancreatitis, the pancreas suck all the calcium from the system to make soap. We call it saponification. The fat absorbed with bind with the calcium, and it forms a soap that lead to decrease in calcium. So you expect this as a finding in pancreatitis. So we have to replace the calcium, but we hold on to that because it's a priority. So we're going down. Mid epigastric. So now this is our priority. Okay, mid epigastric pain, 8 out of 10. So the pancreas is located in the mid epigastrium. If you have itis, which is inflammation, you should have pain. So this is expected finding. So I'm not worried about it. So now we're still holding on to our calcium. Bilateral flank ecchymosis. So there's ecchymosis here. There's there's blue here. There's blue also here. That's ecchymosis. We have blue color. Bruises here. So there's 2 bruises, which is ecchymosis on both flank area. This is dangerous. That is hemorrhage. This is what we call gray tenor sign. The pancreas is located in your back, retroperitoneum. So when they bleed, it tracks towards the back and it goes to the side of your abdominal wall. The reason why the pancreas can bleed is because the pancreas, there's something called splenic artery. The artery runs behind it. So when the pancreas gets inflamed, it can penetrate into the vessel and the vessel can bleed. And so this is hemorrhage. This is hemorrhage. And hemorrhage in the B-sharp is shock. So we find 1 B-sharp and we have to hold on to that. Initially, we found calcium electrolyte. We held on to that, but then we find a better one, which is hemorrhage. So I'm keeping this one. So that's the right answer. You see how you can analyze the question. You keep on going and then you find the right one. You find something on the B-sharp, no matter what. Which of the following patients should be seen first? Okay, so who would you see first? I put it in either a SATA or no SATA, but it doesn't matter. Who do you see first? A client with a kidney biopsy and a map of that. Okay, so who do you see first? You have a patient with kidney biopsy and a map. When you do kidney biopsy, there's a concept. that you have to know. The kidney is a highly vascularized organ. So when you stick a vascularized organ, it bleeds. Therefore, when somebody have liver biopsy, your number one option as a nurse in your NCLEX is hemorrhage. I'm looking for bleeding. If there's bleeding, I'm seeing these patients. So you have to watch them for at least 6 hours, and you have to check for bleeding, signs of bleeding, tachycardia, hypotension, low urine output, and ecchymosis on the flank, ecchymosis in the periumbilical area, and then check their map. They don't want to give you a blood pressure so that you can say, oh, this is normal. They want you to think. So you have to know how to calculate map, and you have to know normal. So this patient is not bleeding. A client with chronic renal failure and a calcium of 8.6. When you have chronic renal failure, calcium level is going to be high because of lack of absorption and because your PTH level is high, leading to low calcium. And your body cannot, the kidney cannot do its function well to help with calcium absorption. And therefore your calcium is low and your phosphate is high. Okay, 8.6 is not that low, it's in the low normal, and then therefore this is what is expected. A client with the back pain, 3 hours of cardiac catheterization. This doesn't sound good. So this is the, if this is the, let me write here. If this is the body, when we're doing cardiac catheterization, you go into the groin, and you go here, let me use another glue. They go here into the femoral artery, and they go all the way into your heart, and they do the catheterization. At the end of it, this groin wound has to be taken care of. The puncture wound has to be watched by the nurse for at least 6 hours for bleeding. And therefore, if the patient had back pain, that means there's hemorrhage going into the retroperitoneum. That's a sign of hemorrhage. So this patient is bleeding. I'm seeing this patient. A client with throbbing, unilateral headache, and light sensitivity. There's big words, buzzwords, but none of them is important. It's throbbing, fine. Unilateral, one side. Headache, okay. Light sensitivity. This is migraine. If you tell me this is the worst headache of your life, yeah, that one is never localized. That is subarachnoid hemorrhage. And that one is deadly. And therefore, the only person you see is number 3 from cardiac catheterization and bleeding. But they did not tell me it's bleeding, or they told me it's back pain. This back pain is going to make the patient lose their limb, and therefore this is hemorrhage based on what we know from cardiac catheterization. Another question, the same story, right? Which of the following should be seen first? Okay, we have a client with a sudden onset of tearing chest pain radiating to the back. So this is the chest, tearing chest pain radiating towards the back. There's buzzword, tearing chest pain radiating towards the back. This is thoracic aortic aneurysm tearing. So rupture of the thoracic aortic aneurysm. This is deadly, this is bleeding, and this is shock. So this patient need to be seen. So the buzzword is tearing chest pain radiating towards the back, and that's a sign of hemorrhage. A client with AFib on heparin and a PTT of 130 seconds. You know that your PTT should be 60, right? It shouldn't go past 100. I mean, usually you multiplying the PT by 2 and 2.5. So definitely this shouldn't go past a certain number. So 130 is too high. Therefore, you have to watch for bleeding. This is the bleeding episode right there. You have to stop the heparin, check another PTT later on, and watch for bleeding. So this patient needs to be seen. It's not good. A client with liver biopsy and laying on the left side 2 hours after the procedure. Liver and spleen, and kidney are the same. Your liver is on the left side, is on the right side. Okay, this is the liver, is on the right side. It's also a vascular organ. If you do a biopsy, your number one priority is bleeding. Watch for bleeding, the same thing you do for the kidney. In order to prevent bleeding, we put pressure on the liver. The only way you can put pressure on the liver is for the patient to lay on the right side. Patient laying on the left side is no. That's red flag. This patient is bleeding. He's going to bleed. He's going to bleed, so you have to intervene. So I need to see this patient. The management is lay on the right side for a couple of hours, minimum 4 to 6 hours, to prevent bleeding. A client with kidney biopsy and a urine output of 10 cc for 5 hours. Yeah, the kidney biopsy, you know, there's a risk of bleeding, and P for just 10 cc an hour for the past 5 hours. That's hemorrhage right there. Patient is bleeding, is in shock, and therefore we need to see this patient. So that's what you can, these are the examples of what you should be looking for when they give you a hemorrhage question. And this will be our last one. The same thing, just want to give it to you guys so that you can see variation of the question and the way they can frame it. Which of the following patients should be seen first? I try to do it like a SATA and at the same time priority so that we can do them on the same list. You can, it doesn't mean there's more, there may be more than one patient who need to be seen. Is because that's the way these are passing level questions. So you have multiple, you know your staff, and you can identify multiple patients who you need to see first. A client with AFib on Coumadin with black tarry stool. I don't have to tell you that black tarry stool is melanin, and that is bleeding. So this patient, we need to see. He's on Coumadin and he's bleeding. No. A client with abdominal bruit and a back pain. So if this is your body, this is your belly button, the aorta comes like that, and they divide into two. If there's an aneurysm here, you're going to hear a bruit in the abdomen. And if you have back pain, it's a rupture. So this guy is bleeding. He's bleeding from rupture abdominal aortic aneurysm. These are all variations they can put in terms of this. They are few, but they can write in such a way that you get to figure out which one is bleeding, which one is not. A client with angioplasty, coronary angioplasty with back pain 2 hours after the procedure. So it's the same thing. You've seen this question, it's just a variation. So coronary angioplasty is the same thing as cardiac catheterization. Same thing, going through the groin, put the wire in, finished, and come out. We have to watch the groin side for hemorrhage. So patient has back pain, is bleeding retroperitoneally. Therefore, I need to see them. A client with severe claudication, so an acute onset of abdominal pain radiating towards the back. That's another way of them asking you that. Just know that this is the knowledge content. If you have severe claudication, claudication is an ischemia, demand ischemia, when that means you have peripheral vascular disease, PAD. Peripheral vascular disease doesn't mean it's your leg. Your neck carotid artery may be affected. Your heart artery is also affected. Your abdominal artery is also affected. Your leg. So anybody with a PAD, the whole artery in their body is also affected. So this patient probably have aortic abdominal aneurysm. And so they have acute onset of abdominal pain radiating to the back. That means the rupture of the aneurysm. This, you have to see this patient. A client with coronary angioplasty with a MAP of 55, 1 hour after the procedure. We already talked about MAP, mean arterial pressure. It has to be greater than 60. Less than 50, patient is bleeding right after the angioplasty. So probably he or she is having hemorrhage from the angioplasty, so retroperitoneal hemorrhage. As you can see, it's different variation. I try to keep on writing so that I can use the same words, change it to try to trick you. That is the same thing. All these 5 patients is different variation of hemorrhage. And this is how you can apply the B-sharp. These are examples of patients that you need to identify and then figure out if they have bleeding issue. I usually put them together in your exams. They will not put all these things together. They will give you something that has hemorrhage, the rest doesn't have hemorrhage. But I want you to recognize which one, all the variations that they can have hemorrhage. So that I put all of them together. You're seeing all these patients, you got to see them. When you see these signs, please see them. This is the end of it. Thank you for your time. Thank you for listening. And please keep on subscribing to the channel for more content like this. Take care of yourself and keep on charging. Bye-bye.